So let's go through them. Nope. You can see the back here, so that's kind of useful. This will be the left brachiocephalic vein. This is the right brachiocephalic vein, and they join to form the superior vena cava. A lot of students ask me, well, what's this little guy? This is called the azygos. I never ask it. Well, it's not funny, is it? I mean,
Hey, thank you for saving this time. I had to go look up how to spell it.
this is the pulmonary trunk. Notice it's a different color, right? It's an artery, not a vein. And it divides into the left pulmonary artery and the right pulmonary artery. You can see it better here, right? This will be the right pulmonary artery. This is the left pulmonary artery. This is the aorta. This is the brachiocephalic artery. It's going to divide very quickly into the common carotid and the brachiocephalic, excuse me, the subclavian. The right common carotid and the subclavian. These two that are adjacent are sometimes fused, just like this, to form a left brachiocephalic. But in most people, they are separate. And this would be the left common carotid artery. And this would be the left subclavian artery. And of course, coming down here, this is the aortic arch. This would be the thoracic aorta here. And then when it hits the abdomen, it'll be the abdominal aorta. But you can't ask them because you can't stick a pin in them here. On the bottom, here we go, this is the inferior vena cava coming in. And these are the pulmonary veins. Notice they are red. All right, circulation of the heart, the coronary circuit, right? This is the right coronary artery. This is the right marginal artery. It's on the side, right? Marginal artery. This is called the circumflex artery. This is the anterior interventricular artery because it's between the two ventricles. It's in that groove or where the septum is supplied. This is the posterior interventricular artery. I think you can see it better here. Sometimes there are two, but a lot of times you don't have this branch here. You just have this one here, and it branches out. So this is the one I typically point to. This is the posterior interventricular vein. This is the anterior interventricular vein, and they dump into this huge swelling, which is called the coronary sinus. This is your left coronary artery. You don't get to see much of it on these models, just a little bit right there. Of course, it extends out into the front here. Left coronary artery, it goes to the septum, along with a lot of other places. That's why we call this one the widow maker, right? If it gets stopped up. And then there's a left marginal artery and a left marginal vein. My stent, I have a stent in my heart, is in this vessel right here, the left marginal oblique. So, hey, I might like to ask that one because I got a stent in mine. So if it had blocked off completely, it was 90% blocked. If it had blocked off completely, this part of my heart would have died. Not enough to kill me, but enough to put my ass in the dirt, so to say. Okay, got those? At the next station, we'll have it open like this. And this may be open too. So we can have it at any number of angles. Find a way. Or I can have two hearts. I mean, whichever. This is the apex of the heart. Of course, this is the right atrium, right ventricle. This is the left ventricle. Right atrium, left atrium. I probably won't ask you the atria. I assume you know that. Right? I'll be much more detailed. Typical questions. Name this structure right here. That's the septum interventriculare, or interventricular septum. Very important because it's full of nodal tissue. And if that dies, that's where the widowmaker kicks in, right? All of this is myocardium. This is muscle. This is a special muscle. See how it sticks up like this or like this? These are called papillary muscles. When they cut across like this, they're called trabecular muscles. I usually don't ask papillary muscles or trabecular, but it's good for you to know them. These are called cardi tendinae, and they're part of this valve. This valve is your right atrioventricular valve. I can see they were asking it at some point. The right atrioventricular valve, also known as the tricuspid valve. It's between the right atrium and the right ventricle. This valve is the pulmonary semilunar valve. This valve here is called the bicuspid valve, or the left atrioventricular valve, because you see it goes to the left atrium, left from the left atrium to the left ventricles. It also has cardi tendinae. These help pull it open and closed, right? It's also known as the mitral valve. So super important valve. And then the one deep inside the heart, here, is the aortic semilunar valve. It goes to the aorta. So 4 major valves. You can have trouble with any one of them. When they're opening and closing, they make different noises. So they keep track of those. That's part of what you do when you're listening to the heart, right? This circular disc inside here, which may be more obvious here, maybe not. This is the fossa ovalis. The fossa ovalis is the closed-off scar of the foramen ovale. When we study the baby's heart, we'll see there's an opening between the right and left atrium. It closes off at birth, shunning the blood to the lungs, so you start breathing, right? And it's called the fossa ovalis, this scar. And about, I don't know, 7 to 10% of the people, it doesn't close off completely, and there's some leakage, which may lead to a stroke. There's also a junction in the baby where the aorta and the pulmonary trunk join. And you can see it here. Once you are born, it closes off. It's known as the ductus arteriosus. But when it closes off like this and forms scar tissue, it's known as the ligamentum arteriosum. You also have a ligamentum venosum between the umbilical cord and the inferior vena cava, but we have no models that show that, so I can't ask it. So ligamentum arteriosum and fossa ovalis are remnants, scar tissue from your prenatal life, right? So I don't know what this guy was asking. Septum interventriculare, mitral valve, and I guess identify the cavity, which would be the left ventricle. See, it's hard to ask the left ventricle. All right. Any questions?